Women's health has come under attack in our area, and the county government has not acted to protect it. To understand why, we need to answer these questions. How has women's health come under attack? What should the county do? What can you do? Doctors can currently come into our county to perform surgeries, damage the woman during the operation, and leave hurt patients behind without a backup doctor to care for them. The most recent example of this is Ulrich Klopfer, an abortionist who recently lost his medical license after decades of dangerous practices. Here are the South Bend Tribune passages that came out during his hearing. Klopfer spoke of a 10-year-old girl raped by her uncle, who he performed an abortion on, but didn't notify police about the child abuse. Instead, he let her go home with her parents, who knew of the rape and refused to prosecute. Klopfer didn't give pain medication to all women, only those under 16 and those who could pay extra. During a previous hearing, local doctors called him out for abandoning patients. Dr. Carlton Lyons said he's spoken with Klopfer while treating one of his patients in the emergency room. Klopfer told him to handle the complications, and that he didn't have admitting privileges, and wouldn't give the name of his backup doctor, already required by state law. He left me with no other options for the management of her care, Lyons said. I had to take her into surgery. The city council had a chance to protect women from doctors like this in 2015, when it considered the Patient Safety Ordinance. The ordinance was common sense regulation for traveling doctors. Have a backup doctor. This was not a partisan issue. All council members said they would support this type of legislation during their campaigns, regardless of their party. But only a handful followed through on their campaign promises, saying it was unnecessary. Is that true? When Allen County passed the same ordinance, Dr. Klopfer couldn't operate in the area anymore. This would have worked here too. This is not a pro-choice, pro-life issue, it's women's safety, and when given the opportunity to protect it, the council should act. You can help make this county safer for women by voting for John Henry as County Councilman for District G on November 8th. As a father and husband, John cares about women's health and wants to make our county safer for everyone. He has volunteered for crisis pregnancy centers, and he has been a consultant for Indiana Health Systems to create safer environments for women. To learn more about him and his mission to improve local government, please visit www.johnhenrycampaign.com.